Welcome back. Now, a recent report by the Central Pollution Control Board to the NGT has revealed that the water at the Pryagaraj Triveni Sangam during the ongoing Maha Kumbh has high levels of fecal coliform, making it unsafe for bathing or consumption. The CPCB report indicates that the water quality is not conforming to bathing standards with fecal contamination from human waste. Experts warn that the water poses health risks, including waterborne diseases. The NGT has directed the Uttar Pradesh government to examine the report and respond at its next hearing.
The water of the holy Triveni Sangam is riddled with fecal matter, making it unfit for bathing, let alone drinking. The National Green Tribunal was informed of this through a report by the CPCB. The report says that various locations in Pryagaraj during the ongoing Mahakumbh were not conforming to the primary water quality for bathing with respect to the level of fecal coliform. Fecal coliform, a marker of sewage contamination, has a permissible limit of 2,500 units per 100 ml according to the Central Pollution Control Board or CPCB.
आज के समय में बड़ी शॉकिंग रिपोर्ट आई है सीपीसीबी की, सेंट्रल पोल्यूशन कंट्रोल बोर्ड की, जिसमें उसने बहुत क्लियरली लिखा है कि कहीं भी पानी नहाने लायक है ही नहीं। तो जो 144 साल के नाम पे लोग वहाँ पर अभी जाके गंगा स्नान कर रहे हैं, तो वो एक धोखा है, एक नज़रिए से धोखा है, क्योंकि वो एक साफ पानी में जो उनकी श्रद्धा है उसके साथ साथ जो उन्हें पानी जो साफ चाहिए था वो मिल ही नहीं रहा। साथ में एक और शॉकिंग रिपोर्ट ये आया है उसमें सीपीसीबी के कि जो भी लोगों का मलमूत्र है वो फिर से गंगा जी में जा रहा है। तो आज के समय में जो गंगा जी का पानी है वो मलमूत्र के साथ आ रहा है।
उस रिपोर्ट में वो बताया गया है कि जो पानी है वो कंटामिनेटेड है और फीकल मैटर से कंटामिनेटेड है। इसका ये मतलब है कि जो सैनिटाइजेशन वहाँ पे होनी चाहिए, सैनिटरी की जितनी तैयारी होनी चाहिए वो उतनी नहीं है, और कहीं जो हमारे जो फीकस में जो स्टूल में जो हमारे बैक्टीरिया है वो पानी में पहुंच रहे हैं, तो वो इसीलिए ना कंजम्पशन के लिए ठीक है और ना वो नहाने के लिए ठीक है। सो वो रिपोर्ट में ये बताया गया है। जब भी ऐसा होता है जो कि इन्फेक्टेड वाटर होता है, उससे बहुत सारी वाटरबॉर्न डिजीज़ हो सकती हैं, स्किन की डिजीज़ भी हो सकती हैं, और जो डिजीज़ हैं जैसे कि लूज मोशंस हो सकते हैं, डायरियल डिजीज़ हो सकती है, वॉमिटिंग हो सकती है, टाइफाइड टाइप की, कॉलरा हो सकता है, ये सब चीज़ें हो सकती हैं।
A bench comprising NGT chairperson Justice Prakash Srivastav, judicial member Justice Sudhir Agarwal and expert member A. Senthil Vale was hearing the issue of preventing sewage discharge into the Ganga and Yamuna rivers in Pryagraj. The bench noted that the CPCB had filed a report dated February 3rd pointing out certain non-compliances or violations.
दयनीय स्थिति है। सरकार को चाहिए था कि इस पे पहले से पुख्ता इंतजाम करती। 144 साल बाद अगर कोई पर्व आ रहा है तो उसको धूमधाम के साथ, सफाई के साथ अगर मनाया जाए तो बहुत अच्छा होगा।
The tribunal has allowed 1 day for the Uttar Pradesh Council to examine the report and file a response. The concerned state authority has been directed to appear virtually at the next hearing on February 19th.
Let me go across to my guest now. I've been waiting quite patiently. Vimlendu is one of India's foremost and most highly regarded environmentalists, and also joining me is Dr. Ishwar Gilada, who is one of India's best-known infectious diseases specialists. Thank you both gentlemen for joining me. Vimlendu, coming to you first. To any environmentalist, I'm sure the findings of the CPCB report would not be very surprising given the fact that problems of pollution and fecal coliform in Ganga and Yamuna have always persisted. But what perhaps is puzzling as to the attempt by the Uttar Pradesh Pollution Control Board to play it down?
So indeed, as in, if you look at the figures that came pre-Kumbh, in the month of November itself, biological oxygen demand in Ganga was actually 3 times worse than the permissible limits. The coliform levels were actually 10 times worse than the permissible limits. And there was already an NGT study, an NGT reprimand from 2019 Kumbh, which actually talked about an epidemic like a situation that the past Kumbh was. And this mega Kumbh or Maha Kumbh that we're actually talking about, which actually brings in more than 500 million people, this was ought to happen, because largely, if you look at the health of the river, Ganga is one of the most polluted rivers of our country, not just of our country, of our world, and it is a grand collective failure of state government, various state governments, and also the central government. So the current numbers that we're actually seeing is not surprising at all. But the fact that UP Pollution Control Board wasn't really eager to put forth the number, or also not to put forth the action taken report for days together, clearly shows that the government doesn't want people to know how polluted the river is. Because in the name of faith, we can't, sometimes we think that the faith is going to take care of millions of people who are actually taking a dip, but scientific temperament is extremely important. And a water that has such high level of coliform level, such high level of biological oxygen demand. And by the way, coliform means excreta. So when we're talking about almost 1600 times worse coliform level than the permissible limits, sorry to say, but actually this is not a holy dip. It's an unholy, fecal dip or excreta dip that people are forced to take in the name of faith. And might be there could be some amount of short-term punya, but long-term, as the doctor was actually talking about from Gangaram Hospital, it will have a huge impact. Also, by the way, right now we're only talking about coliform levels. There's enough study that's actually been done also in terms of solid waste management. In 2019, NGT actually said that this is going to be an epidemic like a situation. And right now with Maha Kumbh, I fear by the end of this month, when Maha Kumbh is over, with amount of solid waste visuals that we're actually getting, situation is only going to get worse for the river, its people, and also flora and fauna, the aquatic life.
Yeah, that's an important point, Vimlendu, because the findings of the National Pollution Control Board are from the samples collected between January 13th to 19th, which is just the first week of the Kumbh, which I believe started on the 13th of January. So one can only imagine what the condition would be right now at the Sangam. Dr. Ishwar Gilada, we already heard some of those voices in that report which PTA had prepared. But since you are one of the foremost infectious diseases specialists on the country today, what would be the key problems coming out from water which is so highly contaminated with fecal matter, as Vimlendu has been pointing out?
See, as has been pointed out by other speakers and other panelists, you see, if we don't expect something, that is miracle. With so many people gathering at one place, like you do in election exit poll, you just do exit poll of people attending those kind of holy baths. Ask them 3 questions. Number 1, how many of you urinated there? How many of you clean your nose there? How many did a gargle there? And all 3 are potential forms of infecting the flowing water. Secondly, water treatment in flowing water is very difficult. So whenever you talk about water treatment plant, they are in a water reservoirs, they are in well, they are in some kind of tanks. It cannot be in the river. You can do that, but it is not effective. Thirdly, for such all big gathering, we should expect that these things are going to happen. Therefore, most common infection being typhoid, people should have been vaccinated against typhoid. People should have been told about what can happen, whether to consume that water or not, even as a Ganga Jal, 1 drop or even a spoon. So I think this, because whenever you put faith against healthcare workers or any healthcare expert, it seems that we are against faith. We are not against faith. We are against blind faith. So you can, everybody, even I have a faith, but my faith should not become a blind faith. What is happening in such kind of large gathering is not a blind faith. Thirdly, ask a question that if you have to go to defecation, where do you go? There is such a big crowd, very good arrangement may have been made, but the arrangement for X people cannot be suffice for arrangement for 100 and X people, 100 times more people. So that kind of arrangement failure will be there, always there. And people would take a bath, defecate there, urinate there, clean their nose there, and still will say that we are doing a pious job. So I think we need to look at from all angles. On one hand, we are talking about going on Mars and Moon. We believe in science. On the other hand, we have a blind faith. So we have to have this dichotomy, and we need to have a very good dialogue pre such big gathering era. so that the experts are there, they can guide, they can put a lot of wordings there, what to do, what not to do, what kind of vaccination to be done. One good thing is that there is a very common virus called rotavirus, and there are a lot of children also going there, and it is very much prevalent in them. But almost all the children are vaccinated against rotavirus. And
Okay.
India is one country which has provided rotavirus at peanut cost to the rest of the world. So some infections are preventable. Hepatitis A is very common to this. So there are bacterial infection, there are infection to parasites, viruses, protozoa, and number of infections can be there. And we need to keep a watch for next 6 months or 3 months, depending on the incubation period of those infections.
Vimlendu,
Over to you, Rita.
where do we draw the line between not impinging on faith and not indulging in blind faith, as Dr. Gilada pointed out? Because let's be realistic here. The solution could have never been not to hold the Kumbh Mela. But the problem was that we were holding the largest congregation of humanity, especially for a religious purpose, at an event where pollution at source has always been a problem. How was there any way this could have been managed better, perhaps in terms of reducing the crowd, perhaps in terms of amping up facilities, but keeping in mind that the mentality of most of Indians often is to create, is not to safeguard the environment but rather to pollute?
So, Ritangshu, the thing is that, organizing faith events is also part of governance in that sense. And of course, right now, when we look at the local Uttar Pradesh government, a lot of its resource, human power has actually gone in organizing this Kumbh. But they fail to understand that a Kumbh largely when we're looking at celebrating the river and a holy dip in the river, for that you need a river. And that's why I said that November data that is actually there, which is pre-Kumbh, already talks about that there's no semblance of a river in terms of the data, in terms of biological oxygen demand level, the dissolved metal levels, coliform levels. And by the way, all of this, as in we still are seeing a better Ganga because there's been extra water that is actually being released from Tehri Dam and many other hydel projects. Also, there are some temporary these tubes and the storage and sewage management systems that's actually been made. And despite that, there's these alarming levels of pollution that we're actually seeing. I think it's very, very important for the government to understand that as important is faith, so much should also be public health, because this is not just about health of the river and public ecology that we're talking about. We're talking about public health and the long-term impact that it has. What Dr. Saab was actually talking about right now, that imagine when you end up polluting the river, which is already so polluted, and then the only thing that perhaps the river has in its hand is monsoon. Wait for the monsoon for all this pollution to get flushed. So we need to take cognizance and have scientific temperament. We cannot have blind faith. We understand that people, poor or rich, they all want to take a holy dip. But sheer color of the river, which is gray, the readings, and by the way, it's the government data that we're talking about. This is not an international conspiracy to defame Kumbh. We're not talking about civil society organization or an American-based research group or a Tukre gang coming up with this data. This is government's own submission.
Or a USAID organization.
Absolutely. A Soros-funded organization trying to defame India and India's faith, for that matter. Here we're actually talking about government of India that actually also puts forth mostly conservative figures or say the honest figures only from almost pre-mid Kumbh. Post-Kumbh, right now, February 20th data, we don't really have. February 19th data, we don't really have. Situation is worse. And the impact that the post-Kumbh is actually going to be more dangerous than the Kumbh that we're actually talking about.
Well, yes, that's what the point. You have talked about the impact of post-Kumbh on the river ecosystem, especially in terms of the ongoing efforts to clean up Ganga and Yamuna. Dr. Gilada, I'm going to look at the impact on the human anatomy and the human health post-Kumbh here. There are a lot of viewers, I'm sure, who are watching this broadcast who have just come from the Kumbh or are planning to go to the Kumbh, including in my own office as well. What would be, I know it's paradoxical to look at having a disinfectant bath after going and taking a dip for something that's supposed to cleanse you of your sins. But for people who are planning to go to the Kumbh or have just returned to the Kumbh, what are the key safety precautions in terms of keeping the health safe? Would you advise, Dr. Gilada?
See, basically, whenever we look at such kind of issues, we always mostly talk about monetary value today. For example, whenever some drug is caught, 23 crore worth of drug is caught. We don't say that how many thousands of people will be put on drug addiction. Similarly, here we say that we spend X amount of money on Kumbh and we are going to earn so much amount of money. So this monetization should stop. And secondly, individually, see, we should think that if I cannot take a particular water or particular thing to as a potable, I should not do any kind of dirt and filth in that water. So that education has to be given to people. And thirdly, avoid going to such kind of conglomerates. For example, compulsory reason you have to go is different. But otherwise, better not to go. Have a darshan from above and from TV. That's why we call Dur Darshan. Dur Darshan is better than real darshan.
Well, fair enough. As you pointed out, Dr. Gilada, it's important to also keep, I mean, there should be a Sangam, if I may say so, of rationality and faith as well. And I think that is something which sometimes gets lost when people get swayed by blind faith. But thank you so much, Vimlendu and Dr. Gilada, for joining us on this short but important discussion. We will, of course, be discussing it at a lot more detail later on at probably 8 p.m. today as well.